Top Bed Talk.
Good morning, everybody. My name's Mike Ramsey. I'm chair of the board of directors of the Patient Safety Movement Foundation. I'm also chairman of the Department of Anesthesiology at Baylor University Medical Center in Dallas, Texas. And I'm going to talk about patient safety, something that obviously we're all very concerned about, and yet patients still come to harm under our care, and patients even die under our care from preventable causes. So this introduction is going to be about how do you make the changes that change culture in our healthcare system so that it's safer, that it's hardwired safety, like we have in the airline industry, like we have in a lot of technology industries as well, particularly the nuclear industry. And that's what I'm going to spend about 15 minutes talking about, and then we'll have a panel discussion about what we can do, what we can't do, what works, what doesn't work. So, first of all, disclosures. I received research grant support from the Massimo Corporation. They've made an unrestricted educational grant to this EBPOM organization, and they've also made grants to the Patient Safety Movement Foundation. So the Patient Safety Movement Foundation was founded in 2012 by Joe Chiani, and he was an electrical engineer. He's got into healthcare monitoring systems, formed a big healthcare company. But what he realized was that the restrictions that he has in terms of protocols, measurements, oversight in terms of strict oversight in terms of protocols that the industry has don't seem to apply to healthcare. And he became aware that from a study from Johns Hopkins that there was probably around 200,000 preventable deaths in healthcare in the USA a year because of errors. These are preventable deaths. And when we look at harm, now we're talking in terms of millions. So why are we not hardwired in safety as many other industries are? And so that's what he wanted to get into, put together an organization that would involve leaderships around the country and then around the world to make our healthcare system safer and the global healthcare system safer. So who are we? We create the best practices that we can find and are proven best practices. In other words, we want hospitals to come to us or healthcare systems to come to us with protocols that have clearly saved lives in their institutions. An example would be from Houston. We got a central line protocol that they could show us how that had reduced central line infection rates and mortality since they instituted that protocol to zero. Now, we know now what our central line mortality and morbidity is at Baylor University Medical Center. We've instituted their protocols, but it's not zero. We're close to zero, some months with zero, but not always. And that's because we have emergencies where we have to put lines in where we can't follow the protocol. They have to go in emergently. But now we try and remove those lines after 24 hours and replace them with ones put in per protocol so we can get our numbers down to zero as well. This is an example of the kind of what we call apps that we've created that are out there online. They're available for everybody to access. They're living documents, so they're reviewed regularly. And if you come up with a better protocol and can prove it to us, we'll change it. So these are the facts that have really stimulated this Patient Safety Movement Foundation to exist. And that's the fact that despite all the other safety organizations we have, there's still an enormous number of preventable deaths, not just in the United States, but across the globe. It's the third leading cause of death in the US behind heart disease and cancer. That's way, way too high. It's the 14th leading cause of death globally, more than TB, malaria, and HIV combined. And the cost of this is enormous. It's been estimated up to almost $1,000 billion. a year. So we've got leadership involved in healthcare systems, in politics, in entertainment, in every branch of industry, as we try to come up with solutions and get these solutions hardwired into the healthcare. And you can see here we've had politicians, ex-presidents involved, vice presidents involved, President Tedros of the World Health Organization, and Jeremy Hunt, who ran for Prime Minister of the UK this last time. But he came on board as healthcare minister and has made big contributions to us. So since 2012 to 2020, where we wanted to get to zero preventable deaths, it looks like from independent sources that from the protocols we put in place, there were 366,353 lives saved. This is independent from us. 92 signed open data pledges from 93 partners. These are industrial partners where they'll share their data, not the IP of their technology, but the data that comes out of their technology can be integrated into all the other technologies that we monitor patients with, and can use artificial intelligence to help predict when a patient's getting into trouble. And this has been very helpful too. So now our vision is zero preventable deaths by 2030, and focusing on eliminating preventable harm and death across the healthcare system across the globe, and creating a sense of urgency to this. We can no longer hope for zero, we've got a plan for zero. And we have a hashtag Plan for Zero link that you can log on to and get in, join with, and give your opinions and give us more ideas through this link. These are our strategic aims, is prioritizing safety with patients at the center, promoting dignity, compassion, and respect in healthcare, aligning everyone who influences or is touched by healthcare, which is just about everybody. Promote transparency. You don't know what the preventable mortality rate of your hospital is today. We want that opened up so that you can log on and find out what it is, because there's nothing like transparency to change culture. Realigning incentives, i.e. payment, to safer care. Prove that you have safer care, you get reimbursed more, or your healthcare system gets reimbursed more. Inform patients, caregivers, families, all about patient safety. Identify the preventable causes, publish them, put them out there with the actionable solutions. And these are all online so that you can log on, look at them, criticize them if you don't think they're correct, but prove that you have a better plan. If you can, we'll change it. Drive the implementation of these apps in all hospitals, and ask the healthcare companies, all of them, to share their data so that we have a data superhighway that we can use artificial intelligence to know when patients are getting into trouble. Do they get into trouble? Just to show you a couple that hit the newspapers recently, that CMS threatened to terminate Vanderbilt's Medicare contract over a fatal medication error. A nurse gave a muscle relaxant instead of a sedation drug to a patient undergoing an MRI. They were paralyzed, they couldn't breathe, they died. Now, why did that happen? Why was the process not in place that could not happen? That nurse didn't intend to hurt the patient. That wasn't her goal at all. Her goal was to help the patient. Yet that happened. CMS threatens to terminate their contract. Well, let's be more transparent. Let's look at the problem. Let's implement measures to mitigate that risk, prevent it happening again. That's how we're going to correct this situation. Houston Hospital replaces leadership after blood transfusion mistake. Well, again, there's a punishment there. Why don't they look at the process, make Houston Hospital look at that process, correct it so that we have the best practice in place that this cannot happen? In other words, we need leadership. We need to create a high reliability organization like we have in the airline industry, like we have in the nuclear industry. We want that culture of safety, non-punitive environment, Yes, we want accountability. If you do something off protocol and the patient gets hurt, you have to be accountable. But that's not what occurred here. We need standardization and hardwiring of safety. And this is what Jeremy Hunt did in the UK. He changed the punishment probe at doctors into, if they make an honest mistake, they'll get more support to prevent those mistakes happening again. That was revolutionary to occur in the healthcare system. It still does not occur in the US, and we need it to, that honest mistakes will get support. Accountability is needed if you cut corners and make mistakes. Is zero possible? Can we develop a culture of safety? Let everybody speak up if they see something incorrect happening. We can do it. In our hospital at Baylor, Scott and White in Dallas, we have these signs on every email sent. We have it in every corridor, zero harm. So it's right in front of everybody working in the hospital. We want zero harm here. We do not want patients hurt. There's a little white square on this poster, and that's where you put your own commitment. And you can change that from month to month on how you're going to help create a culture of zero harm. And I think this is leadership in action, helping to change the culture. How do you change the culture? Well, the greatest single impediment to error, according to Lucienne Leap, is that we punish people for making mistakes. And that's a mistake is different from cutting a corner and where we need accountability. When somebody's got the best intentions and mistake occurs, then that shouldn't have happened. We should have a protocol in place to prevent that happening again. We need to look at it. We need to be transparent. Everybody needs to learn from it immediately and correct the situation. That's how we're going to make a change. And Sidney Dekker has written a lot about this. The just culture is the balance between the science of safety and accountability. And sometimes it's a fine line, but we have to take the right line and make the changes that are necessary so that we ask what is responsible, not who is responsible. In other words, it was the protocol that people were doing that was responsible for the mistake, not the person. And we need to make those protocols hardwired so they're safe. So this just culture accepts nobody's account as true or right and others wrong. In other words, it creates a climate in which disclosure is possible and acceptable and is the organization's responsibility. The main question for a just culture is not about matching consequences with outcome. It is this: did the assessments and actions of the professionals at the time make sense, given their knowledge, their goals, their additional demands, their organizational context? In other words, we need that process in place so that you can't make the mistake that people make right now. And when you ask them, why did you do something? Well, that's the way I've always done it. We need to have these hardwired, safe protocols in place, like the airline industry, the checks in place, the checklists in place. One area that a change has been made, and that's where the candor process being put in place. And this is came out of Chicago and is now at MedStar in Washington, D.C., and it stands for Communication and Optimal Resolution. And what it is that if an event occurs where unexpected patient harm happens, then the candor process comes in immediately. And that is where the patient is told, or the patient's family is told, that harm has occurred, and you're going to look at it and report back immediately if we think an error has been made. And this requires a paradigm shift away from the traditional responses to harm events where people go quiet. Full, open interaction with the patient family normally does not occur. This causes for extensive and ongoing communication with openness with families. And we have a group that comes in and looks at what went wrong, why did it go wrong, and it supports the caregivers as well as the families. And this then builds off disseminating lessons learned and solutions to prevent harm in the future. The activation of the Candor team is within 30 minutes of a bad outcome. Response and disclosure within 60 minutes with support for the patient and family and caregivers. Event investigation and analysis, interviews, hold the patient's bill. Determine if standard care was met. If it was, then we tell the family, we tell the patient that everything correct was done. But if it wasn't, it's shared also with the family. And from that point on, there is no billing of the patient. All the further medical bills are taken care of by the hospital, the healthcare system. Since MedStar Health introduced that program of openness, they've reduced their serious patient safety events by 65% since 2012. In other words, everybody in the hospital knows what happened. They've learned from that mistake. They put in processes to prevent it happening again. They reduced the cost of care associated with serious safety events, including medical liability payments, by more than $17 million since this openness, this candor has been put in place. So there's something to be said for that. What's our strategic plan in the Patient Safety Movement Foundation? One, we want funding. We've got to generate funding so that we can keep the process going that we're doing right now, so that we can have awareness across the healthcare systems, so we can develop and deploy a digital marketing strategy that will be online, so that we can have these protocols available in multiple languages on smart devices, so that people can get online right away and see the best practice. We want legislation that will reward hospitals that have the best practices, have the safest care. We want it transparent so we can see what the safe care is in every institution. We want partnerships with hospitals and technology companies so that we have the right solutions available for everyone to take the best care of their patients. These apps are just blueprints for best care. They're living documents. They're updated whenever we get more information. You can come online and update them by showing us what your best practice is and how good it is, and prove it. And we will go off proof. The apps are all related to patient care issues, related to mental health, to airways, to abdominal areas, to drugs, to medication errors, to falls, to pressure ulcers, to every branch of healthcare where patients get hurt. We're getting best practices put together so we can hardwire safe best practices. The 5-star hospitals are those that have instituted all the apps, and there are a number of them that have done it. And those hospitals are the safest hospitals. We have select hospital commitments from others where they've introduced many of them, but not all of them. We've got select partners that are working with us, and because we want to work with everybody who's involved in safety in medicine, we want to be able to get a power pack together of all these organizations, medical organizations that are related to healthcare safety, so that we can all put our best efforts together, pull them together, unite, and have the best practices out there. Planning for Zero, the Children's Hospital of Orange County, who have introduced all the apps that we've come up with, also tie the board of directors' compensation to reaching zero preventable harm in the hospital. The road to patient safety success involves transparency, patient and family partnerships, human factors integration, reliability culture, process design. All these things from industry can apply to healthcare to make our hospitals safer. We did a survey this year, since COVID was out there, about what was really concerning patients with healthcare right now, or the general public with healthcare. And it was interesting, the number one at the moment, because of the incidence of COVID infections into healthcare workers, has been healthcare worker health. So suddenly the patient base has expanded. Now the healthcare workers are part of that patient base, because we've all become patients very quickly if we don't have the right protective equipment. And that's been a big problem with COVID. It'll be ongoing with other infections going forward. So now we've broadened this base of protecting patients by protecting healthcare workers as well. So healthcare today is not as safe for our doctors or nurses, let alone patients. We've got to change that, and we will change that. The accomplishments from 2019 is 93,276 lives saved. That's an independent audit. 4,793 hospitals have committed to using these apps across 48 countries, and 92 healthcare technology companies have signed an open data bridge where they will share their data that's gained from patients so we can put it together to get a compendium of what's happening to the patient. What can you do? You can build momentum for patient safety, plan for change, don't just hope for change, make a public pledge that you'll get your institution to implement the apps. If you don't like the apps, come up with better ones. We will work with you. What is measured improves. What is measured publicly improves faster. And join us for #Unite for Safe Care on World Patient Safety Day, which is just coming up in a couple of days, September the 17th, where we're going to have about 3 hours of video from leaders in all branches of industry, politics, entertainment, healthcare, to talk for about 10 minutes on video about how they see healthcare becoming safer and help us all reach the goal. So the vision of zero, can we do it? Let's look at the success of anesthesia. Anesthesia came up with the Anesthesia Patient Safety Foundation. We went from a mortality under anesthesia when I started in the 60s of 1 patient in 10,000 anesthetics to now where anesthesia is so safe, we're taking on just about everybody. There's almost not a contraindication to anesthesia, and the mortality related to anesthesia is 1 in 250,000. And so that's been something that's been educational that came out of anesthesia. We can apply the same model right across healthcare. Our hospitals should be safe havens, not danger zones. So with that, we'll now turn to a panel discussion. So I thank you all very much indeed. Thank you.
Top Med Talk.
Thanks for downloading Top Med Talk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, Top Med Talk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.